Well, according to Statistics South Africa, more than 83,000 children between the ages of 10 and 17 gave birth countrywide during the 2019-2020 financial year. KwaZulu-Natal is the province with the highest number of teenagers who were impregnated, accounting for about 8,500 of those cases. Let's talk about this. We're joined tonight by Nelisiwe Vilakazi, head of the KwaZulu-Natal. It's 18,000 cases, I should say, above 18,000 cases of teenagers being impregnated in KwaZulu-Natal. Let's take this further. We're joined by Nelisiwe Vilakazi, head of KwaZulu-Natal's Department of Social Development. A very good evening to you, ma'am. Welcome to the program. So this is clearly a crisis. Do you have a handle on the situation?
Good evening to you, and thank you very much for having us in your show. We do understand the statistics that has been published about teenage pregnancy in KwaZulu-Natal.
And how are you addressing this problem? Because it's a very serious one.
Yes, it is a serious problem because by law, the teenagers are not supposed to get pregnant. You know that at some point, depending on the age of the child, it's referred to as a statutory rape, and it's a sexual offense. So no one is allowed to have to make teenagers pregnant. So the challenge that we have is that these statistics they are published after the wrongdoing has happened. So what we have done as the Department of Social Development, we are strengthening our prevention programs so that we are able to reach the teenagers before they fall into prey of being victims of teenage pregnancy. For example, the prevention programs that we've come up with include the social behavior change programs. But what is important is that we need the parents to see them playing a very critical role in terms of how the children need to be brought up, and also enlightening them on the dangers of teenage pregnancy, and also to be very careful in terms of the movement of their children, because these things, most of the time when you get closer, you find that they happen just around homes, or maybe the perpetrators are people that are familiar with the children, that are relatives to the children, and you find that some cases are not reported. For example, when you compare the cases that are published and the cases that are referred to us as the Department of Social Development, the statistics are not the same, because most of the time we find those cases are not referred to us to say this is a statutory rape, so that you can even try and profile the child, so that you can even profile who the father of the child is, so that those people are brought to books.
And the problem, I suppose, while it's worth applauding the fact that the government is speaking to children, teenagers, about safe sex and sexual abuse, sexual violence, the problem is, in the bulk of these cases, as we've seen in various studies, adults are the perpetrators. It is grown people who are raping these girls.
Yes, when you look at it, it is that way, because you find that the statistics, they show us that girls as young as 10 years and 11-year-old, those are the girls that fall pregnant. It's very rare. We haven't seen where a 10-year-old boy has impregnated a child that is a girl that is 10 years, or an even 11-year-old boy. So it's very clear that the perpetrators are adults who take advantage of the children. That's why it's important that before you reach out to as government, but within families, there is a lot of work that needs to be done within families in terms of how do they socialize their children, how do they respect their children as parents, as uncles, and also bringing back Ubuntu within the families. So that is very much important, because you find that as we run social behavior change programs with the children, but the adults who are perpetrators are not part of those programs. And that's why it's important that as we reach out to the children, We also reach out to the parents, the caregivers, and so on. At some point, we had dialogues with the children, and they said it's fine that you dialogue with us, but think about traditional leaders, think about traditional healers, our parents, our uncles. Just ensure that you reach out to them as well, because those are the people who are perpetrators.
So basically tell the men in society to stop raping children. And just on that point, 18,550 girls, children, were impregnated in KwaZulu-Natal between 2019 and 2020, according to stats that say it is a shocking number. What are the hopes of any justice for those girls who were indeed raped by adults?
At this point in time, we have this coordinating forum with the key departments in the province. But the key departments that we've started to engage with is Department of Health and Department of Education. So the challenge that we are consulting with our legal advisors within the departments, because if a child is 12 years old or 13 years old, is a patient with the Department of Health, in terms of POPIA Act, that child must consent to that department for her information to be referred to other departments so that there is intervention. So we want to see the legalities so that Department of Health is very much clear in terms of referring that pregnant child to us so that we can intervene and address the matters accordingly, including that of the perpetrators and so on. Same applies with the Department of Education, because Department of Education's mandate is very clear, teaching and learning. So now referring that pregnant child to us, they must also ensure that they are not contravening other issues in terms of child protection. So the legal advisors within departments are trying to advise us so that we intervene and protect the children accordingly. And also for the children to be able to report these cases themselves, because it's much better if a child reports. It's easier for you to take action and address those matters and profile the child, and also ensure that the perpetrator is brought to books. Because some other things that we think is important is that even agencies that employ people where there are children, we must ensure that those people are checked against the register, so that if a person maybe is a pedophile or it's a person who is a risk in working in the environment with the children, that person is not employed, because by so doing we'll also be protecting our children as well.
And what are the attitudes of the traditional leaders and the families that you've been speaking to on this campaign? Do they understand why it is so important to speak to children, not only about sexual reproductive health, but about sexual violence, and why it is that even if the sexual abuser is a family member, a community leader, it needs to be addressed and spoken about quite openly?
Yes, the series of engagements with them have not yet started. It's starting in April, so that we dialogue with them, because there is valuable input and information that we can get from the traditional leaders themselves, as well as traditional healers, as far as the issues of teenage pregnancy is concerned.
Ms. Nelisiwe Vilakazi, KZN, Head of the Social Development Department, good to have your time, ma'am. Thank you.